our history broadcast line. A really huge development. The godfather of vaccine programs in Aaron deposed several years ago. Basically, with the paper to see what they have been fighting for now, which is there are no vaccine safety studies being done pre-pricing or long-term studies. One of the vaccines is going through that process. Therefore, you cannot say they're safe. And then they'll tell you, well, we're doing robust post-market surveillance, be it in the newspaper, none of those things are happening. The solution is we need funding to do that. Pretty shocking when the news agencies can tell me it's already been done, to hear the Godfather program now saying, if you want to have that done, you actually care about safety, then we need funding. So that's amazing. I think and just with Congress just last week, how long was the testimony you gave?
Oh, it's a 2-hour hearing with one witness.
Yeah.
That's fine.
So for us, this conversation has always been very controversial. Vaccines, and we got involved with it. Got involved with vaccines. The film I released around this topic, I left CBS to make a documentary in 2016. Aaron and I teamed up in 2016 and bringing these lawsuits, bringing clarity to the situation. And then COVID hit and changed everything. Because for most of you, all this just sounded like some crazy whack-a-mole anti-vaxxers were out there saying these products aren't being safety tested. When COVID came and Donald Trump said for warp speed, the coronavirus vaccine on the market, we said, here we go. Now the world's going to watch how we do this every time. We all got to see that, doctors will say, well, at least come around and say, well, that vaccine is anomaly. It was rushed on the market. It shouldn't have been done that way. The truth is, it's one of the highest tested vaccines we have. It's terrible. It's a terrible vaccine, but it got actually a longer trial and actually had a placebo for a moment. No child vaccine was given through that process. So you watch how all vaccines are made. They've all been rushed on the market, and then it gives you assumption upon assumption upon assumption to tell you that they're safe, effective. In that same time period, the explosion of this vaccine program was about, it was 10, 11 vaccines in 1986.
Yeah, I was saying that in the early 1980s, we only had 3 routine vaccines, total 7 injections. And now the CDC schedule has over 90 injections. And in that time period, we watched how the kids, declined from 12.8% chronic illness, which was, neurological disorder, autoimmune disease in the 1980s, to the last time they gave us data was 2011. At that point, 54% of our children, 1 in 2 now has a chronic illness that will have for the rest of their lives. So when they tell you, when CDC, FDA, government says we're making health here, there's the science says the exact opposite. We're the sickest generation of kids we've ever seen in this country. We're the sickest nation of kids in the industrialized world. We have more autoimmune disease and neurological disorders than any other industrialized nation in the world. Something's gone incredibly wrong. People will say to me, well, Del, how do you know it's not the pesticides in our food? The glyphosate sprayed on 90% of our crops, or the steroids being pumped into our feed sources, or the fluoride in our water, or the chemtrails that are in the sky, whatever the case, And I'll say this, look, first of all, through here in Syria, we've assumed on almost all of those topics. But whether it's one of those things or vaccines causing this disease epidemic, every one of those things has been approved and set safe by safe regulatory agencies, FDA, CDC, NIH, EPA. So we have a serious problem. We're being poisoned, and our government is, protecting corporations, giving them liability protection instead of protecting us. So that's really what this is all about. Just background. If you want to give a little bit about some.
Yeah, I want to touch a couple of things. The number one piece here is fear. And I want to be clear on more than one piece. The first piece is the public fear. Every bad thing government does to us, it's because we're afraid of Americans. It's been very rare that Americans have voluntarily given out their freedom to nothing. We give it up because we're worried, we're scared, government save us, right? Whether that's the war on poverty, or war on drugs, whether it's vaccine, whatever it might be, we're scared, so government it, and then we say, okay. So you consider and say, well, what about the bags? Now look at a mother who's afraid her baby is going to die. Hard to fight that, right? Fear does move a lot of people and allows us to constantly give away our freedom. The problem is we never get them back. That's if it was really just okay, just for this week and then no, we never get them back because we get accustomed to this level of prison. Whatever that prison is, we get accustomed to the next level of prison. There's another piece of this, and that is the companies who resist to doing this, they have no fear. To your point, they have not. What happens in almost every case, and you know my background, I've been also in company before. What happens is there's some issue of concern. Somebody comes to the room, there's one lawyer at least, not two, and say, hey, we have a plan. The plan's going to make $50 million. You go, great. See, it goes, what goes wrong? Well, I said, don't worry about it. Please go along. Pay $85 million. Oh, great. Do it. Then they go to lunch. They go to lunch. Whatever the repercussions are, they are. The lawyer handles it. This man has to fight. Right? The lawyers don't handle it. They just move on. So they're not actually cruel or mean. They're apathetic. There's a difference. Them being apathetic changes how they think. And what if all of a sudden they had to be free? To your point, they had to be accountable in some way, either personally or through their company or something. If they were afraid, things would change. So fear is a key. Fear of the individuals who just go, okay, government safety because I'm afraid. And the lack of freedom to make decisions, you just go, yeah, fine, that's good enough, move on. That would change both of those. One way we can, I brought this up at my office, was stopping a very important thing. I would ask you, is there anyone who knows, who believes that monopoly is good? Anybody? Yeah, nobody. No matter where you go, you have a monopoly. But all those agencies you talk about, it's government monopoly. That's what it is. Now, am I saying get rid of all of them? You don't have to. You don't have no regulators. Try to get rid of them all. You've heard already. Everyone gets scared. That's that fear thing. Right? Everyone's afraid. Let them exist. But have a secondary model that is not a monopoly. That you as a consumer can say, I will either follow the FDA or I will follow this private organization who decides X, Y, and Z. But Larry, the board way, we have an example already. If any of you go to health food stores or natural food stores, the vast majority of those products are not in any way checked out by the FDA or any of those things. They're actually checked out by a third-party private organization in some way, shape, or form. Now, I would ask you, where are all the deaths from all health food stores? None. The healthiest people you know shop there, right? That's true. But there's no FDA there. Why? You break the monopoly and you satisfy the fear and you can make change.
Right, that's a great setup for what I want to get started. That we may be involved or not. But this really sort of why I titled this. This is loosely saying fascism should more appropriately be called corporatism because it's a merger of state and corporate power. I think that this is really the issue that we're facing in this country. We have a total corporatism. We have the lobbyists now are making all of our politicians are working for us. They're working with corporations and their needs, and nothing exemplifies that more than this issue on health, medicine, pharmaceutical industry being the #1 largest lobby in America. They outspend oil and gas lobby 2 to 1, twice as much. One thing, before COVID ever hit, I said, look out, it's going to be a pandemic, because I'm watching this lobby spend more than anything we've ever seen. What do we think they're trying to get? That they actually care like 3% of the hippies unvaccinated kids and somehow they're mandating? No. They want to mandate a product like every adult in this country to turn all the human emissions like they did during COVID. Saw it happen. Hundreds of billions of dollars be made if they can get the government forcing to take the product. So that's corporatism. Now, at the heart of corporatism is corporations. The WEF, how many people are really aware of the World Economic Forum and what it's doing in Davos every year? Okay, they're bragging about the fact that they're installing our politicians, that Obama is visiting and talking to Clintons, that they put Trudeau in office, they trained Trudeau. They're bragging that there's this new ideal is being set by corporations in order to dictate, if you will, how government should work, how climate, using things like climate science, with WHO, world pandemics. But as I said in my first talk, you don't have to guess. They're telling you exactly what they mean. Listen to them. You probably seen this video, but I want to visit it again. These are the 8 predictions put out by them. I'm not making fun of it, it's not satire. This is their vision for the world for us. You'll own nothing and you'll be happy. Whatever you want, you'll rent. The U.S. won't be the world's biggest superpower. A handful of countries dominate it. You have organs made by computers. You'll eat a lot less meat. You've got cricket flowers coming your way. Climate change is going to displace everybody. Better open up those borders and that's you've got. Shut down industry wherever we can. Once we've messed everything up really bad, let's go to Mars. They sure are pushing our values to the good. Now, when I watch this video, there's just several things that really jump out at me. But this idea that this is a dream scenario being celebrated, dictated from homes or politicians coming out. Aaron, just from he worked Knesset, we were involved in Israel working in constitutional rights there for a while as a out of law school. What happens when corporations like this get involved with policy recommendations?
I did quote from the chief justice of Israel here in law school, but I would say my opinions and views about corporations really were formed more so after that time, when I worked with one of the leading law firms in the country, representing Fortune 100 companies and multi-billion-dollar students, and quite a different vantage point. And I think it's a point that we made earlier. It's not necessarily nefarious what they do. It's just good business. Whatever's good for the bottom line will drive their conduct. And when you look at this WF slide, that you just showed, who funds WF? According to their website, 1,000 corporations fund some American governments as well, 1,000 corporations. And that first slide showed it said, who own nothing. Okay, who will? Who's own it? Right. They don't answer that. And of course, if you own nothing, it's really a big piece of what needs to be competitive in life.
Right. What are your thoughts on this, Larry? We're seeing this in action. It's not like this. It's not like a club, which I mean, if you go all the way back to the world, but we now have very powerful clubs affecting, the governance around the world.
Reality of this, they rely on compliance. Right? That they rely on compliance. What's the best way to keep your population compliant? Go back to again, theory. Here's the question. If we keep people afraid, they will comply. That's no issue, right? When does torture and blackmail not work? I don't care. Doesn't I don't care. Get me whatever, I don't care. Whatever, I don't care. Once that is, you see it in our world of cancellation. Who can't get canceled? Who says, I don't care. Right? Compliance is the key. We have to not comply. That's a critical piece. But here's your point. It's easy for me to comply if I own something. If I can go someplace, if I have the resources to buy my own, right? You see the people who are canceled very often are wealthy, right? Because they're able to deal with it. But what happens when I'm working my 9-to-5 job? If I don't comply, I lose my job and I can't pay my bills. That's one of our bigger issues, right? I'm not against the corporations in general, it's why it's around today. But if we create a better environment, we'll get better corporations. We have a worse environment, we'll get worse corporations. One issue we have is, to get to the point, the individual making that decision is not accountable. And I understand that part of having a corporation is to be protected, I get it. But if you're doing things that are harming people, someone must be held accountable. And all of a sudden I'm held accountable, it will change, right? Imagine that same scenario I made earlier, right? There's a boardroom CEO goes, how much we made, $50,000, $50 million, something was wrong. Now the lawyer says, well, I justify me, there's a chance you might go to jail. What? You might go to jail, it's possible you go to jail. Whoa, okay, maybe we should do that thing anymore. All of a sudden things change. So I go back to the system does matter. Breaking monopolies does matter. Accountability matters. That's how it's done.
To add to that, I completely agree that fear is the lever that's used to take away your rights. Right? The corporations having a profit motive is typically often good. It incentivizes them to make good products, to make better cars, right? And with every product on the market, it brings back to vaccines. For every product on the market, that's a good example. The companies that make those products, they have an incentive to make it safe with their profit motive and their safety aligned, their desire to make it safe. It's not safe, they're held accountable. That's why drugs are often tested in near consumer control trials. Why? Because the FDA requires it? Not really. The companies want to know before those products come on the market whether or not they're going to cause mass harm. Because if they do, the companies are liable. Look at the top 5 selling drugs by Pfizer, all time according to 2018. 4 different drugs on testing, 4 drugs have had multi-year placebo control trials for the license. Pfizer wants to know what the placebo control. But when it came to the one other product on that list, which is COVID-19 vaccine, it was not tested against placebo. It was only response to safety. That's the divide you see. Vaccine is the only product on the market where you really can't sue the manufacturer or harm. You see the end result, which is that companies' conduct conforms accordingly to the bottom line. Going back to fear, okay, one last point on fear magnitude is this. If you're going to be afraid of it, then look back at the long arc of history. Look back and what has brought more harm and destruction on humanity than anything else. I'll tell you, it's not a virus or bacteria or pestilence. It was the idea that a government, that a king, dictator, central authority, better you how to live your life, tell you how to live your life. If you needed to cede your rights to some central, whether it's agency or government authority, and often the way that they took the rights was fear. So if you're going to be afraid of the government taking away your rights.
Here's a perfect example. So when I watched that video, there's a lot of like everyone will rent and people see, you look at BlackRock, State Street, Vanguard, they're promising to own every home in America, I think somewhere inside of 2030. So that, the biggest corporate entities in the world are now competing with us buying a home. We just had a situation in Texas trying to get insurance for a house we're renting out. And they said we're no longer insuring the house for that amount in Texas. There's too much climate problems. Therefore, and so we had to go outside of Texas to like Lord's of London and pay 3 times what we're paying. Luckily, we can pay that. I'm wondering how many houses across America, because of climate change, they're going to start saying you're no longer insured. If you haven't paid your house off, the bank now insure it like hundreds of dollars a day, which is one of the things offered. And I think you're going to watch all the houses be squeezed right out of the hands of people all across America. But I want to get back to health. How do you make people stop being weak? I showed this in Texas, especially, like, oh, my dead body, man, all the day in my state's not goddamn he'll do it. You're here. But I don't think you're really thinking about how far they are. If you've been watching the news, pay attention to how health and the fear of the next pandemic is actually about to affect your
That's the
business.
story that impacts farming in Minnesota as well as like in my grocery store.
Food spreads in lower Michigan, poultry and cattle. Farmers are becoming more concerned about food supply.
So in particular, they're talking about bird flu kits in Iowa farms. The next user says more than 4 million chickens will be slaughtered after bird flu was detected at a project farm. Some 23 million birds have been killed in Iowa since 2022.
So just to put it in perspective, we probably called in the United States alone between 90 and 100 million birds in the last year and a half due to
H5 and months. World Health Organization is investigating a man in Mexico who died of a type of bird flu known as H5N2. Now, 3 farm workers in the U.S. have been infected mildly with that virus.
What is the level of concern right now about that potentially becoming a pandemic? I'm really concerned, because we're making the same mistakes today that we made with COVID. We should be testing every cow. We could do pool easy guy. We have the technology. We could be pool testing every dairy worker. I do believe that there's undetected cases in humans, because we're once again only tracking people with symptoms. You have things that require vaccines for at-risk farmers. We're really prepared to not only test the current vaccines that we have in the stockpile, but also to really develop specific vaccines.
Okay, just to begin with, I think you get it already 100 million birds have been killed in America. And by the way, no wild birds are, you hear about a bird flu pandemic happening wild, it's not happening. But wherever you use PCR testing to detect anything that's not there, suddenly you start wiping out chickens. What happens? They have mad cattle, and this is when they start wiping out all their cattle. They're setting up to be able to start killing all of our cows across America. So what happens to your food supply when that happens? And by the way, I doubt this will be an issue for farmers, because I'm pretty sure they'll go ahead and pay the farmer for that cow. They're just going to wipe out every cow that's out there. There'll be a few left. What do you think that will cost? Who do you think will be able to afford to have that steak? So if you think of my dead body, I can stop eating meat. Look, you're a vegetarian. I get it. That's cool. It's a choice. This is America. But I really think this is terrifying when you look at how they're using fear to wipe out your food supply. They're using fear all over Europe to shut down farms. Even my brother's a vegan. I argue with him. It's the same thing in big ag. Based on nitrogen and fertilizer, what they're saying is somehow affecting our climate. They're shutting down farms all over England, all over Europe. Tractors are driving into France in the middle of the towns and saying, wait a minute, you're shutting down our farms. You're shutting down ranchers and farmers all over the world right now as we speak, as a dictate of the World Economic Forum that WHO's need to make the earth safer and healthier.
People eat the bugs.
Crickets.
People eat the bugs. You missed the transport twice. There were 3 people who were wildly affected. You said that.
Right.
That's definitely reason to shut the entire program.
That's it.
It's definitely reason to kill up 100 million birds. But you notice she actually said that. She said there were 3 people mildly affected. And then what did the person say? Well, let's test everything, everybody, scare the world. I am so worried. Why does it make any sense? You can say 3 people died. 3 people mildly affected, and now we must jump the hoops. And here's the worst part. The worst part is, what if there really is a really bad thing happening? What if there really is some killer virus from somebody or something that's actually trying to kill everybody? None of us will know what to do.
Yeah.
None of us will know what and who. We'll have no idea. We just thought we get it. But if you actually broke up to where multiple people, multiple organizations could share all the information at exactly the point, we can choose. We can see. When I ran for governor, and this happened in New York State, people ask what should you do? The first thing I said is, if the New York State government wants to have its own rules or regulations that it thinks is correct, let them have that. But they're not forced, because here's what the government believes, and also allow other people to put that, hey, here's what we think, and allow people to choose the one. And this way, it can change as we find new ideas and new things, we can shift and adjust. But what happens to the government is, once you use force, they can't go back. And I have to insist on this. Once I shut your business down, once I arrest you, I can never say I was wrong. All I can do is double down. This is why you don't want to resort to force. If the government, what happened in New York State is, if you didn't do what New York State said, we shut you down, we fined you, we took your license away, we literally put you in jail. That literally happened in New York State for lockdowns. My plan is, I literally put out public, you can see it was, here's what New York State says is correct. If you choose to do so, you will get a New York State stamp. That's it. Now the communities decide, do I want to go to the state fund, do I want to go to the not one, what happened, and every community will figure it out. Wait a minute, there's a difference. Or there is a difference. Or one's better than the other. protocol are the individual people making decisions in their own communities. Because you know what? Brooklyn isn't the same as some farmland in upstate New York. There are two separate areas and communities can decide. We didn't do that.
Yeah, I think that, just to sort of,
You can laugh.
yeah, go ahead, John. There's so much that I would love to talk about this, but the part of this, and three, it also comes to censorship. I mean, if you're being censored or you're not getting the information, you are not free. You have no ability to actually make a decent decision for yourself. None of us had decent information, especially everyone that wasn't watching the high wire. You didn't know what was going on with COVID. You didn't know how bad that vaccine was. You didn't know how it killed animals in all the trials. Or being worse than human beings. You didn't know that there was no safety test. You didn't know that the FDA never proved it could stop transmission. We were saying all those things and being censored. You had to go direct to my website. It wasn't being shared. It was shared on YouTube, it was shut down. It was shared on Facebook, it was shut down. That is the greatest tragedy going on. And that is where the United States of America, we're in a very desperate situation. Where we only have much more time, so I want to just double down a little bit on bird flu, because it's getting really scary out there. And that last piece you were saying, we're working on vaccines. They're selling hundreds of millions of vaccines, countries all over the world. They're lining up to buy it. As soon as the government starts buying protection for a virus that doesn't exist, you better start imagining they're pretty sure it's going to exist. This is Robert Redfield, who's our former head of CDC during the pandemic. This is what he has to say.
Could we be on the verge of another pandemic, and one that could be even worse than the one caused by coronavirus? This topic could actually be birthed. Former CDC Director Robert Redfield, who helped oversee our country's response to COVID, says it is definitely time to take this more seriously.
Yes, Brian, I really do think it's very likely that we will at some time. It's not a question of if, it's more of a question of when we will have a bird flu pandemic. As you mentioned, unfortunately, bird flu when it does enter humans, has a significant mortality, probably somewhere between 25 and 50% mortality. So it's going to be quite complicated. Since 2019, we've had a progressive increase in bird flu in chickens and ducks and turkeys in our country. And since then, you've seen it now go into a number of mammals. It's now at over 25 different mammals. I think now with the llamas recently, it's now 27 mammals in the United States. Why is that important? Is we know exactly what has to happen for bird flu to be infectious for humans and go human to human. Scientists in 2012 actually did experiments in the lab using gain of function research, which I'm not in favor of, but the scientists did it, and they figured the 5 amino acids that have to change in the key receptor in order for bird flu to gain a propensity to bind to the human receptor and then be able to go human to human. Something that obviously happened with COVID, where COVID obviously learned how to use the H2 receptor in humans, and of course became a very infectious virus. I'm less concerned though that this will happen through spillover and evolution in animals. I'm much more concerned that this will happen in the laboratory through gain of function research.
I think that about says it all. As you all, as I said in the first talk, the coronavirus is not a natural virus. It's now known by the entire world to come from a lab. We built it. We gave it the ability, as he said, that it actually evolved to be able to affect human beings. We gave it that ability. They're giving bird flu that ability. But I want to call some fear in here, because some of this is a lie. We're going to use fear we're talking about. It's going to be used to get you to do things that you would never do before. But let me be really clear about the science around viruses and bacteria, things like that. If bird flu, as they say, is able to kill 30 to 50% of people that come in contact with it, it will never sweep the world. It cannot do it. Let me make this clear. Viruses get less and less virulent as they evolve, because if you believe in the concept of evolution, it wants to proliferate, it wants to spread across the world. It cannot spread. The farmer that came in contact with it somehow catches it and dies face down in the barn. He wasn't able to spread it to his wife. It didn't even get to his wife. It couldn't get out of it. Let's say it takes 5 hours to kill you. then you're right, some kids maybe never got out of college, that's the one. But the point is viruses that are that deadly cannot sweep the world. It is only a virus that you can catch, not when you have it, be asymptomatic, walk around, give it to everyone you know, 2 weeks later you've got a spastic throat, those things, which is what coronavirus was. And for some people, it can be very problematic that have other comorbidities, elderly. But ultimately, this idea of a virus is 30-50%. By the way, coronavirus ended up killing 0.35% of everyone around the world. And that only got to 0.35% because those were aged about 70 and had at least 2 other comorbidities like diabetes and heart disease. They were the most vulnerable. For children to be forced vaccinated with a very terrible vaccine, their death rate across the world is 0.0002%. Those are kids that had a 0 risk, and we injected them with a dangerous virus to try to protect the elderly. It's the first time we've ever used our children as our frontline defense for the elderly. It was crazy, but I want to make that clear. 30-50% sounds terrifying. If it is that deadly, it will not get outside of the town to start. Okay.
Yeah, I'm sorry, I didn't. Sure, look at it on the concept of mandates in regards to the bird flu. You don't need to mandate water or food. You don't need to mandate public health initiatives. You only need to do it when there's a question about the safety of the disease, right? Government should work with persuading of the merits, right? That's the government's role. The health agency, we should try to persuade. That's all you do. Informed consent. They inform you, and then you choose whether or not to consent. To then mandate over that to say you can go to school, you can engage in civil society. That is exactly the type of government conduct that we formed this country to rebel against. That's the whole idea. It's not actual. You break trust, as it's noted here. You break that trust, and then, like we said, you don't want to trust them afterwards. I'll get to it a few comments on this topic for time. H5N1, the H5 is really only the reason that Dr. Redfield was saying that, because for a virus to be very transmissible, it usually has to replicate in major parents of our lungs. The scientific literature will say that H5 only really binds in the lower respiratory tract. It's really hard to transmit person. That's why if it does end up being very transmissible to humans, it's likely because this came out of the lab. Maurice Hillerman, who was one of the world-renowned vaccinologists who invented many vaccines the other day, he said he predicted there would never be probably a pandemic H5N1, is my understanding, is what is reported. But yet here we face the reality, which now they're saying, almost for certain it's going to happen. That's very concerning that they're concerned, right? That's going to happen. The last line, which is very quick, is they said there was a licensed vaccine for H5N1, it's actually 3. I can quickly just, we should have quickly tell everyone about the 3 shots, okay? These are the clinical trials where a lot about the license. If you don't think you need fear, you can take them. And, leave it at that. First one is by Sanofi. It's the one that they said with the stockpile. It was licensed. This is from the FDA documents. So you can see for yourself. The clinical trial where 103 were vaccinated, 40 out of placebo. That is not enough people. I mean, you can't take that. Here's the worst part. There were 4 serious adverse events in the vaccinated group. 4. Out of 103. But don't worry, Sanofi determined they're not related to your products. Okay, so you're fine. Don't worry. IV biometrics, that's the second vaccine. In the adult trial, the vaccine group had 4 times the rate of immune-mediated diseases. 4 times the rate. But again, don't worry. IV biometrics conducted that trial. Sit around. They only have what? $1 billion? And also they had a trial in there for children, but it only had 800 children, not a power defense for proper trial. Finally, it was applied by Spurs. In the adult trial, 0.5% of the vaccinated group died. Okay? 1 in 200 died. Only 1.1% of the placebo group died. It's a little different, right, gentlemen? It's a little different. Don't worry though, again, Curtis determined none of the deaths are related to their product. So the FDA, they also licensed the children based on Protocol 329. So for all of what I just told you is on the FDA website.
Let me touch this for 1 second, because you're supposed to just say, I live in New York City, in Manchester City, AOC is my congressperson. I accept proposals. So what happened when the lockdown was hit and everyone was afraid is many stores, like you said, some stores got afraid, they moved the chip, did changes and stuff, things happen. But we went so well, we saw anyone who didn't comply, we went all out. We shut down churches. Now I had 2 people in my life who were in their 80s at that time, and both of them had basic conditions. So I was worried, I was scared of them. Like, you're over 80, I love you, I don't want this happen to you. And we're members of the East Orthodox Church. And they love going to church. And I was afraid. I was like, do you really want to go to church? I think something could happen. And one of them said, you know what, I gotta know, it's kind of my community. And here's what I said. I said, look, I'd like you not to go, but if you want to go, I'll drive you. I did that because someone has a right to live their life as they see fit. That I'll support you. He said, no, maybe I'm going to risk my life on my faith. Okay, I'm good, we'll go together. It's fine, but you have this, your life, you own your life. Both of my parents passed away of cancer. When my father passed away, he was like, no matter what, we keep me alive as long as possible. Do whatever it takes. My mother, when she passed, my mother was passing away, I had my daughter, she was a doctor. I won't tolerate it. If I can't spend time with my granddaughter, I don't want to be here. And the question is, which one is the right answer? Both. You are right. When the government makes that choice, now we're worse off. Because if I make a personal error, and maybe I should have gotten back. I don't know. Maybe I should, right? Let's say I make a decision and I don't get it, and I know, okay, it's horrible. I have a problem. When government does it, millions have the problem, and nobody learns. If I do it, you learn. If government does it, no one learns. Last thing I is, this is the worst part. In New York City, at 7 p.m., during the lockdowns, people would come outside of their window and clap for the people who were locking us down. I'm not joking. That is next level Stockholm syndrome. We literally came out, every single people walked out, oh, okay, thank you for the first responders who were locking us down. We took them to our apartments and were clapping for our jailers. I never thought New York was going to be that bad. It broke my heart, and that's why I started fear, and I'm scared myself now that we're not ready to change. I'm so happy people like you're doing. So excellent.
Tedros saying to come and get ready, and we need to stop disinformation. But I don't really have much time. I really want to give you the opportunity here because we've been, from a legal perspective, we watched the enforced mandated vaccine where people were told they couldn't go to work if they didn't get it. We watched forced masks on planes. These didn't go to the courtrooms, and can you just run down what was determined to be unconstitutional on set? Because if they try this again, where do we gain some ground? Where is the light? Because I really feel like the courts in some ways did stand up for our constitutional rights, which were trampled upon during the problems.
2 minutes to sum up?
Yeah.
That was Casey.
Yeah.
So, let me say where things should go.
Yes.
I'll sum this up. I think the people who stood on those balconies and clapped should have the right to do that. And every 18-year-old who wanted to wear 15 masks and live in their basement, stay at home and get a vaccine today should be able to do it, because that's freedom, that's America. But the 80-year-old with 15 comorbidities who said, I want to go get my latte every morning at the store without a mask, should be able to do that too. Because that's freedom, that's America. There was a time in America where everybody used to this college for law school. I remember preaching, what's that? I remember Free Speech Square, and this ethos of civil liberty, we protect the rights, we implore neo-Nazis not to stay when they walk through Jewish neighborhoods in Illinois. We protect their right to do it, protecting their free speech, protecting all of our rights for free speech. And that ethos is the one that I would love to say was the quintessential guiding principle of every crisis. Unfortunately, it wasn't. Many of them had to do with separation of powers. Well, it was the federal government can do that, the state government can do it. The state government can do that, the local government can do it. And the CDC, the OSHA can't require employers to require COVID vaccines. We're not saying that Congress can't do it, we're saying OSHA can't do it. Agency, Congress doesn't have power. To me, I'm hoping that this principle in the next few years, as we engage in more and more litigation, will come shining through, which is that when this country was founded, when the First Amendment was adopted in 1791, life in America was brutal. Brutal. Do you know what life was like in 1791? You don't think they suffered from disease and pestilence? The hardest condition you can imagine. But when the Bill of Rights were adopted, free speech, free assembly was adopted, it was meant to protect us from government overreach, not just for those times, but for times even harder than those. How soft we become and how hard and how distant, unfortunately, American is from what those rights are protecting. I'm hopeful that many of the court decisions that we've seen are starting to recapture this idea. The very first freedom of the First Amendment, freedom of religion, freedom of conscience, live your convictions without government crushing on them. And I think we are moving in the right direction. I can say that all the cases taken in total are definitely moving in the right direction. Many of our cases about freedoms, over 20 AGs have come in. In the OSHA case, over 20 attorney generals brought that case. I think that many of us ever thought it would be a day when 20 attorney generals fighting against vaccine mandates. That is a miracle.
25 U.S. senators, U.S. senators joining Ron Johnson signed a letter that they will never introduce the WHO treaty, no matter what it says, in states all across America. And so that's why, the great part this morning, it's not about being here, it's about being awake. It's about sharing this message with everyone you know. You cannot let them do this again. You cannot let them scare us into submission, because next time, I assure you, they will play harder, they'll play confused, they will cheat, they will lie, they will steal. They're going to do whatever it takes because they know all of them. They know we're waking up. It's issues like this where they push too hard. You can look at all the agendas that have gone on, whether you think it's been going on for 100 years, and say that this was their end game. They never took account for us. They didn't expect us to be here. This is our moment in history. We are writing history right now. And we're going to stay with the freedom of all America, the freedom of hope. It's always going to be. Thank you very much.